Hi, my name is Beaubrun and I'm a board-certified behavior analyst with Brett Denobi & Associates. In this video, we'll be talking about culture-responsive care and function-based treatment. The BCBA task list areas that we're going to be going over is F1, review records available data, including educational and medical records. F3, identify and prioritize socially significant behavior, change goals. And G14, the use of reinforcement procedures to weaken behavior. H9, collaboration with others to support and or provide services to client. School refusal behavior refers to child-motivated refusal to attend school and difficulty attending classes for an entire school day. According to Nathwani et al., school refusal has increased during the COVID-19 pandemic. Chronic absenteeism can have an impact on reading proficiency, graduation rates, college attendance, and overall income. A functional behavior assessment can be conducted to determine the maintaining variables of school refusal behavior. This includes structured diagnostic interviews, questionnaires, behavioral observations, daily ratings, and review of school-based records. These functions can include avoidance of school-based stimuli provoking negative affectivity, escape from aversive social and or evaluative situations, attention seeking from caregivers and parents, or access to tangibles outside of school. Function-based treatment can be developed and implemented to address school refusal behaviors. I'd like to review the function-based treatment to address school refusal behavior during remote instruction. The learner was a 9th grade student attending a self-contained charter high school. This was the 2021 school year, and it was the student's first year at the charter school. The charter school was closed and providing remote instruction due to the COVID-19 pandemic at this time. The student resided at a residential placement as of June of 2020 that year. She had a diagnosis of disruptive mood dysregulation disorder. She had a history of physical abuse, sexual abuse, and severe physical neglect. The student resided with her adoptive mother and adoptive siblings. According to her report card, the student was failing or in danger of failing most of her classes due to her limited participation or not turning in any of the Google Classroom assignments. The student engaged in school refusal behaviors conducted was 100% virtual due to the global pandemic. The results of the FBA hypothesized the primary function of the student's school refusal behavior was to avoid school-based stimuli. The student was new to the charter school. As I mentioned, the school was currently on remote instruction, and therefore the student hadn't had the opportunity to meet her teachers or her peers in person. A secondary function may have been to access tangible reinforcers outside of school, such as sleeping in and engaging in various leisure activities at the residential center. The intervention was differential reinforcement of high rates of behavior. This is where positive reinforcement is provided only when the target behavior occurs at a higher rate than before. There were 3 tiers of reinforcement. Each tier was determined based on baseline data collection. School staff reminded the student that the more classes she attended, the more access to reinforcement she would have. The behavior consultant and the counselor met with the student weekly to establish a contingency for the following week. The behavior consultant also visited the student during class at random to check in. If the student accessed reinforcement based on the contingency for 3 consecutive days or 4 out of 5 school days, the criteria was increased. If criteria was not met after 2 weeks, the criteria was decreased. The criteria would not be decreased below baseline levels. Reinforcement was delivered by the counselor or other staff at the residential treatment center. If the student earned the Tier 3 level, she would still be able to select from any of the 3 tiers. So at Tier 1, if the initial criteria was that if the student attended at least 1 class during the week, she'd earn access to a tangible item whose value was about $1. At Tier 2, if the student attended at least 5 classes during the week, she would earn a tangible item valued at $2 to $5. And at Tier 3, if the student attended all of her classes, she'd earn a tangible item valued above $5. Matching law was applied to this reinforcement system. Examples of the tangible items included false eyelashes. The student had expressed interest in wanting to wear false eyelashes. Therefore, for Tier 1 and Tier 2, was eligible to earn various lashes, but only at Tier 3 would she earn an adhesive in order to apply the lashes. This is an example of matching law that with higher response is a higher valued reinforcer. As a result, there was significant increase in not only the students' attendance, but also participation in school. Unfortunately, due to a significant life event that interrupted the student's residential placement, the student no longer participated or attended her classes. As shown in the current study, the function-based treatment was effective in increasing school attendance and participation and decreasing school refusal. Addressing these behaviors can lead to improved reading proficiency, increased graduation rates, as well as college attendance and better overall income. In this example, the students' cultural specific needs were integrated into the treatment plan to ensure cultural responsive care. Given the student's background, it's essential that there's a high collaboration with treatment providers to ensure that trauma-informed care is being implemented. The student participated in selecting treatment goals, outcomes, including self-care products. Words of affirmation were provided through notes or via direct messages during video conference class time to maintain the student's privacy. A limitation was that there was only one student, and the effects to increase attendance as well as participation in on-task behavior were never concluded, as the behavior consultation ended abruptly when the student moved out of state. Therefore, the intervention was unable to continue. Thanks so much for watching. Please subscribe to our YouTube channel, and to disseminate the science, share this video.
Bye.